In New Zealand, 3,000 people each year are diagnosed with bowel cancer. However, at-home testing can be used by people who are both asymptomatic and have symptoms to identify this early. This can show up in a variety of ways. Symptoms can include bleeding from the bottom, rectal bleeding, change of bowel motions, habits that come and go over several weeks, anemia, severe, persistent or periodic abdominal pain, a lump or mass in the abdomen, tiredness and loss of weight for no obvious reason. Procedure: how to do the test. Allow the test, specimen and buffer to reach room temperature, 15 to 30 degrees Celsius, prior to testing. To collect fecal specimens, the stool specimen should be collected in the stool catcher. It's important to use the stool catcher in the toilet to avoid contamination of the specimen with any kind of chemicals, so no adulteration of the specimen occurs. To process fecal specimens, unscrew the cap of the specimen collection tube and then randomly stab the specimen collection applicator into the fecal specimen in at least 3 different sites. Do not scoop the fecal specimen. Screw on and tighten the cap onto the specimen collection tube. Then shake the specimen collection tube vigorously to mix the specimen and the extraction buffer. Remove the test cassette from the foil pouch and use it as soon as possible. Best results will be obtained if the test is performed immediately after opening the foil pouch. Hold the specimen collection tube upright and open the cap onto the specimen collection tube. Break off the tip, invert the specimen collection tube and transfer 2 full drops of the extracted specimen to the specimen well of the test cassette. Then start the timer. Avoid trapping air bubbles in the specimen well. Read results at 5 minutes. Do not read the results after 10 minutes. Positive. 2 coloured lines appear. One coloured line should be in the control line region, C, and another coloured line should be in the test line region, T. The intensity of the colour in the test line region, T, will vary depending on the concentration of fecal occult blood present in the specimen. Therefore, any shade of colour in the test line region, T, should be considered positive. Negative. One coloured line appears in the control line region, C. No line appears in the test line region, T. Invalid. Control line fails to appear. Insufficient specimen volume or incorrect procedural techniques are the most likely reasons for control line failure. Review the procedure and repeat the test with a new test. If the problem persists, discontinue using the test kit immediately and contact your local distributor.